This is my student support system. Keep watching, keep learning.
Now endocrine pancreas. The pancreas is a pale grey gland weighing about 60 grams. It is about 12 to 15 centimeter long and is situated in epigastric and left hypochondric regions of the abdominal cavity. It consists of a head, body and a tail. Pancreas has both endocrine gland system and exocrine gland system. Exocrine part we have already discussed in digestive system part 4 lecture. Here we will discuss about endocrine part of this pancreas. There are a group of specialized cells called pancreatic islets or islets of Langerhans. These islets are distributed throughout the gland. The islets have no duct, so the hormones diffuse directly into the blood. Each islet has three major types of cells which produce different hormone. Alpha cells which secrete glucagon, beta cells which are the most abundant of these three types of cells and secrete insulin, and delta cells secrete somatostatin. Glucagon. Glucagon has an important role in maintaining normal blood glucose level, especially as the brain and neurons can only use glucose as a fuel. Glucagon has the opposite effect on the blood glucose level to insulin. It stimulates breakdown of glycogen stored in the liver. It activates hepatic gluconeogenesis. It has a major effect on enhancing triglyceride breakdown in the adipose tissue and providing fatty acid fuel for most of the cells, and thus conserving the glucose for brain and neurons. Insulin. Insulin is well known for its effect in reducing the blood glucose level. It is done by facilitating entry of glucose into muscles, adipose tissue and several other tissues, stimulating the liver to store glucose in the form of glycogen. Insulin also have effect on protein, lipid and mineral metabolism. Somatostatin. Somatostatin is actually released by a broad range of tissues, means many organs, many tissues secrete endocrine, somatostatin hormone. Its physiological effect in the pancreas is to release insulin and glucagon. It does this in paracrine fashion. What is paracrine fashion? Paracrine fashion is that the hormone is released and it have local effect. Then this is known as paracrine fashion of hormone function.
My student support system. Keep watching, keep learning.